Thank you all for coming today. This is a program on behalf of the First Family Business Alliance, which is a program of the Greater Reading Chamber Alliance and aids our family businesses here in Berks with the different set of challenges that they come up against because family is involved in business. So today we have Kozlov Stout discussing the evolution of the green phase and what it means. And we titled this before we obviously got thrown back home. So there's even more evolution to talk about. So I won't take up too much time. I'm going to share my screen here and hand it off to Dan Becker of Kozlov Stout and one of our peer group facilitators. I believe that most on here are in a peer group. It is a small, professionally facilitated group that discusses family business topics, as well as you get to share what you're going through in your family business and help each other to get through those times. So I will hand it over to Dan.
Thank you very much, Rachel, and thank you for all for joining us today. At Kozlov Stout, we're actually very happy to come back and try to keep you updated in the ever-changing world of the new coronavirus. I'm sure you heard today in the news that cases nationally have topped the single-day record of over 70,000 new cases. It's crazy. And just listening to the conversation before we began, it sounds like everybody's also fully aware of what happened Wednesday night into Thursday morning at 12:01 Thursday morning with the governor's new order, and kind of rolling us back a little bit from where it was before in light of what's happening out there in the world of the coronavirus. So we're here today, and we're moving all the time. We're constantly updating what we're looking at and the advice out to our clients. So we're here today to give you an update based upon how we see the law and what's in store for you as you try to move forward. So we're hoping that you'll have some questions for us as we go through the program, and that we're able to help you out with planning and figuring out the next steps for your businesses. So without further ado, I'm going to turn this over to, I think, Joan London for a quick update on the agenda.
Hey, good morning and happy Friday morning, although for many of you, there's not so much happy news about it with the governor's announcement. If you could turn to the agenda page. Next slide. Next slide. Right. This is what we're going to be talking about. First, I'm going to give you an update on the governor's order. I've titled it Stay on Course but Trim the Sails, because that's pretty much what's happened. It's a slowdown of the green phase. We're going to be talking about what you can do in your businesses in the event that we would go back to another phase or there are further restrictions. How do we plan for future restrictions? What did we learn from the period from March through June? A topic that is coming up in the summer is vacation. What happens if someone in your workplace has just vacationed at Myrtle Beach or Miami Beach, a COVID hotspot? How do you handle that? How do you protect your workplace while protecting the rights of your employee? The next part, we all have heard the stories of different resistance by customers and employees to some of the regulations, how we can handle that. We've heard the ADA cited, especially with respect to masks and HIPAA. What are employer rights? What are employer obligations? What are some of the reasonable accommodations that could be made to return an employee to the workplace or allow someone to shop who claims inability to wear a mask? And the last part is discussion with all of you. What are you doing to do your part and stop the spread? Let's go to the next slide. Next slide. Okay, just to give you the update, Berks County went to yellow phase of reopening on June 5th and to green phase on June 26th. By July 3rd, the last county, Lebanon County, went to the green phase. City of Philadelphia has been in a modified green phase and will stay there until at least August 1st. With Wednesday's announcement, the state was basically put on a modified green phase. Which is why the title to this session is Stay the Course but Trim the Sails. Why has this happened? There's been an increase in Pennsylvania, as in 40 other states, in new COVID-19 diagnoses. It's especially been in Allegheny County, the Pittsburgh area, and the southwestern part of the state. There were 781 new cases reported yesterday. 1/3 of those were in the Pittsburgh area and the Philadelphia area. And you see the governor's statement. I won't read it to you, but that was the reason for the order. Go to the next slide. The governor and the health secretary refer to Wednesday's order as targeted mitigation, which focuses on several areas that they believe to be the highest risks for spreading the virus, which are in bars and indoor restaurant settings, in the context of larger events, and gyms and fitness facilities. Before we started, we were talking about the impact on bars and restaurants, and let's discuss that first. The bars and restaurants must be either sit-down or dine-in meals at a table or booth, outdoor seating, or takeout meals and beverages. Next slide. I mean, I'm not going to read to you all of these points. You can read them yourself, but the summary is bars and nightclubs are basically closed. Alcoholic beverages are either served for takeout, as has been allowed in sealed containers under a modification to state law during the quarantine, or with a sit-down meal. There's to be no sitting or standing in a bar area, and social distancing, masks, and mitigation measures such as cleaning measures are required for employees and customers. Next slide. The occupancy has been severely limited. The occupancy now is at 25% of the fire code maximum occupancy. If there's an indoor event, it's limited to 25 persons for a gathering, and the maximum occupancy limit includes the staff. So it's extremely limited as to what is allowed for indoor dining. Okay, events and gatherings outside of more than 250 people are prohibited, as are indoor events and gatherings of more than 25 people. And you think of all of the weddings and functions that you've attended in the past, and with the staff, that can easily exceed 250 people. Even for outdoors, if you think of weddings, not uncommon to have 200 or 300 guests. You know, if you indoor events, when 25 people includes the staff, it's a very low threshold. Go to the next slide. Next issue is another one we were talking about before we began, and that is teleworking, work from home arrangements. There's stronger language than in the original green phase on work from home. And it's featured in the governor's order, requiring individual teleworking unless it's not possible. Of course, it doesn't define what possible is. If in-person is necessary, then business has to comply with state orders. We have the links in our presentation on the business safety order and worker safety order, and also the masking order from July 1st is linked to this presentation. So it's well worth reading because they do apply to your facility if you have in person. Next is gyms and fitness facilities. We just had an announcement. There was just an announcement yesterday that Philadelphia is going to allow gyms, indoor gyms and fitness facilities to reopen as of Monday. In green phase counties, other than Philadelphia, they have already been open when went to green phase. Gyms have to give priority to outdoor activities. And we've all seen stories on the news, I'm sure, about gyms reopening and putting their cardio equipment outside, or exercise and yoga classes being held in the parking lot, different creative solutions to avoid to avoid having to wear a mask during exercise, for example. But in indoor gyms and fitness facilities, customers are required to keep the 6-foot distance. And that means sometimes moving the equipment further apart and limiting occupancy. And customers are required to wear masks. And yet that does include while working out. It doesn't mean that the customer can walk in wearing the mask, and what the customer does after that is kind of a wink, wink, nod, nod, that we can't control what you do. And I heard that. And when I went to my gym after the green phase and heard that and had an employee tell me that you don't have to wear a mask while you're working out. I wasn't having any problem doing that, but that's when I decided I was going to stick to running and walking for a while afterwards. But that is the rule. I'll turn the program over to Brian Boland and Courtney Berniker to talk about county modifications to reopening.
Thank you, Joan. As we've already talked about, Philadelphia and Allegheny County, the Pittsburgh area, had already started taking action to do targeted modifications, even though they were in the green, when they started seeing spikes. And actually, Philadelphia had modified green a long time ago. And so we're going to look at that and do a brief examination of how they do that. So all of the pandemic response, all the restrictions by either the Department of Health, the Secretary of Health, the Governor's Office, or these county public health departments are exercised under the authority of the Pennsylvania Disease Prevention and Control Law. And that provides either the Department of Health, which is the state level, or the local board and departments of health when there is one in that respective county or municipality, with the responsibility of prevention and control of communicable and non-communicable disease, such as COVID-19, in that municipality or county. And so when there has been a Department of Public Health or a Board of Public Health formed in that county or municipality, they have the authority to then implement regulations or restrictions. There are very few actually formed in Pennsylvania, and there's a list of them available on the Department of Public Health. There are actually none in Berks County, but there are some in adjacent counties. If you're curious, you're welcome to take a look at that. There are some in Lehigh County and Bucks County, so that if you do any business in other counties or adjacent communities, you might want to take a look at that. So that is, I think that's very interesting. But in Allegheny County, if you go to the next slide, they saw a sharp increase. And Brian likes to joke it's the millennials' fault. And I corrected him that it's Generation Z's fault because he and I like to fight about generations. We have to. Boomer. And once things opened up, the people were excited to go to the bar scene, and they did. There's a lot of bars in Allegheny County, especially in Pittsburgh, a lot of breweries and things, but people got really excited about the bars, and they're very packed. Things got a little packed, and they had a lot of parties, a lot of private parties as well. And we saw a sharp increase in daily case counts from June 30th through July 7th. And that is cited in the order from Allegheny County. And investigations indicated that were conducted by the Department of Public Health in Allegheny County that it was due to crowded conditions at the bars, at restaurants, and large gatherings where alcohol is served. So it's not necessarily the bars and the restaurants, but also people throwing private parties. And so then if we go to the next slide, on July 8th, the Allegheny County Health Department Director, Dr. Deborah Borgen, announced a 2-week order prohibiting indoor dining and alcohol consumption at bars and restaurants and other business establishments. So it was a 2-week prohibition. food service, restaurants and other business establishments with food service were still permitted to provide takeout and delivery, which is very popular in that area. And dine-in service in outdoor seating areas was still allowed. And they referenced the yellow phase guidance that was provided by the governor and the Secretary of Health's office earlier this year. And then they prohibited events and gatherings of more than 25 persons indoors and more than 50 persons outdoors. So it was a little bit more restrictive than the governor's order. If we look at Philadelphia County, they have a different setup where they have a board of health and a department of public health. The mayor's office also has a health commissioner. And rather than doing a more targeted mitigation reaction, they have had a phased plan of their own from the beginning that has corresponded with the phase plan similar to the Secretary of Health at the state level and the governor's plan. But theirs has been progressing a little bit more slowly because Philadelphia is a more condensed population with a little bit more risk. And so they focused on opening different aspects of the businesses or taking certain restrictions and opening things a little bit differently because there was different risks. And so as things were allowed to open and as they evaluated the specific data specific to the county, then the mayor and the Board of Health would issue orders as they transition from each phase. So they also issue restrictions, like they can impose mask requirements for their own businesses, or they can require barriers. We've seen plexiglass barriers in businesses or glass barriers. We have one at our reception desk, which we'll show you a picture of later. They do the social distancing and isolation requirements, crowd reduction, hand washing. They have guidance for their businesses within their county, similar to the guidance that's been offered by the CDC or at the state level. And so we'll show you what their phase approach looks like. It focuses on data similar to what the governor's does, but theirs is focused only at the county level. So if we go to the next slide, they look at specific metrics. And this is their target data to go from different parts of yellow, and they kind of have green and then a second phase of green, yellow and a second phase of yellow. But they do focus on similar data that as to what the state was looking at when we've looked at both Philadelphia and what the data that the state was looking at. And then Philadelphia, if you look to the next one, when they were in the yellow back in June, their restrictions were focused on a lot of childcare and restaurants being open. If you go to the next slide, Rachel. And then they were allowing private swimming clubs and pools to be open, zoos to be open, because they do have a little bit more different things to think about maybe than the entire Commonwealth. Religious gatherings. So it was a little bit more focused on the community of Philadelphia. And then as they transitioned to green, they had to start thinking about malls, museums, and libraries, outdoor performances and small outdoor events, and things like that. So then now they're starting to transition to having gyms open, in-person conventions and conferences. But this was their initial plan. Each order will have the actual restrictions lifted or imposed. But this was the plan. So now we'll talk about how you guys can plan if we have any instructions imposed, such as those on Wednesday. And Brian can talk to you about that.
Okay, thank you. So if you go to the next slide, is a return to yellow or red a possibility? I don't know that specifically that there'll be the likelihood that you're going to see going back to yellow or red, as much as you're likely to see these orders coming down from the governor and the Secretary of Health modifying what we're doing. So I don't know that we'll specifically see that we're going back to yellow. You'll probably see something more like what we're seeing from Pittsburgh and Allegheny County, which are these modifications to target specific areas and that the data suggests is causing the increase in the cases. On the next slide, I have planning for a possible spike. And what we're talking about here is we're looking at the CDC guidelines and regulations. And one of the things that we see quite a bit is resistance to all of these sort of guidelines and regulations. And one of the things I think we need to take a look at is to see how we can use those regulations and guidelines to our advantage. And in some of our larger employers, things such as returning from, a vacation in South Carolina, do you need to quarantine that person for 14 days? The original language said if you went to any one of these 13 states, you needed to quarantine. So the language was rather strange in the first place. There were a lot of questions that were asked by a lot of employers to the department. Then the department came out and modified that and said, it is recommended that you quarantine for 14 days. And I think there's two ways to look at this. One is to say, geez, it's an inconvenience to my company to put these people out of work or put them, have them teleworking for 14 days and quarantine them. On the other hand, the other way to look at the recommendation is it's an advantage to you, which is if that person was in Florida or Texas or South Carolina where the spike is occurring, it may be in your best interest to find a way to have that person telework. Because if that person does in fact bring COVID back to your company, you've got more problems than one person being unproductive or mildly productive. You have the issue of possibly spreading that to other people in your company. Now you've got 15 people or 10 people or 5 people who are not only non-productive, they're ill. We're concerned about them for their own well-being, and they're out of the workplace. And then you're possibly looking at shutting down your whole operation as opposed to just having one person be out for 14 days and possibly find ways to telework. I think we can take a look at some of these things and see if there aren't ways that we can use these measures to our advantage. And the advantage may be a short-term disadvantage that we have one person who's important out of the workplace, but maybe a long-term advantage in that we dodge the bullet of getting COVID into our operation and shutting our operation down, which is obviously even more devastating. We also say here, we talk about possibly having a committee or a group of people to discuss the pandemic response that we have going on. And I know that sounds kind of simple, but we all have views from management as to how this worked the first time we got closed down back in March. A lot of your employees have different views of how it worked and how things might have worked better for them. We discovered in our own office, from time to time, we would go to do things and we would discover certain people didn't have certain types of equipment that allowed them to do things. We were trying to patch those gaps along the way. And other ways that your employees might be able to contribute to developing a plan that might be ready. As we've discussed in our office, Dan, and several others of us have discussed that because of the order that just came down on Wednesday night, all of us are going to need to be ready to turn on a dime again. This is not going to be the last order. I heard the director of the CDC saying this is going to be the most difficult fall and winter medically in the history of the United States. If any of that's true, even if a degree of that's true, we're in for a long haul here. So it may not be a bad idea to develop a committee, and then to also then develop plans that you can implement for people working remotely or sharing shifts or doing other things like that, where the employees can contribute into some of those things to try to cover yourself. The other issue that we're confronting quite a bit is employees, when you first talk about the employee who goes to South Carolina or Florida, we've had employees in our companies come to the HR person or the owner of the company and say, hey, I'm not comfortable if this person comes back and they're in South Carolina because I've got to work right next to them. So that's a second reason that you want to consider that quarantining action. But also, what do you do and if an employee says I don't want to come back, or I'm fearful of coming back to work, or I'm fearful of coming back and working next to so-and-so who is now recovering from COVID. As Brian J. and I have discussed at length, there is a limitless number of these scenarios that are going to be confronted between now and, say, January, February, March, of employees presenting different scenarios to you. My wife has COVID, my son has COVID, my brother-in-law has COVID, I may have been near him. And you need to be able to respond very, very quickly to those things, because you don't want to sit and think. Your best course of action is to be conservative. If you're thinking that person might need to stay out of the workplace, get them out of the workplace until you can call someone like us, or call your doctor that you might be consulting with your company. Get them out and then make the decision, then bring them back, as opposed to leave them in the workplace 2 or 3 days till you make a decision. You may want to look at that. And then, going back and just looking at ways that we, whatever we learned from March and April, what types of things did we discover? What didn't we have enough of? What did we have too much of? Looking at your vendor contracts, your leases, your other types of agreements to see if there are ways that you can improve those, or work on those, whether they're your what's up on your website, your terms of use. If you've shifted your operation from, say, retail to online, or online and delivery. We have a client who was basically a restaurant starting through COVID, but had started to switch to using the operations like Grubhub and DoorDash and so forth. He now says that he's doing over $100,000 in business a month just on Grubhub alone. And he said, I could never take that many orders over the phone and place them with enough phone lines and employees, but I can do it through a point of sale operation. And he said, I could never serve that much food out of my restaurant before, ever, not even close. And so, there are those modifications in operations that, may be able to become effective depending upon the nature of the business and how you might be able to work those things in. But I think planning and trying to get some sort of, some of your ideas in place, bounce some of the ideas off each other, or, people like us, and have a, sort of a well-worn route already, because I think the type of questions that you're going to confront from an employment standpoint and from an operational standpoint are going to be sort of fast and furious here as we head into the fall and the winter. So with that, I'll turn it over to the next section, a vacation from their vacation.
All right, thanks, Brian. So if you could go to the next slide, please. So as Brian was talking about, there's a list of these hotspot states that our department here in Pennsylvania has issued, that these are the states that if you travel to, it is recommended that you quarantine for 14 days upon return. If you see that the first sentence, they kind of give you a generality of just, hey, if you're ever going to an area where there's high amounts, it's on you. You need to, it's recommended you stay home for 14 days. But what was interesting, as Brian just noted, when they first posted this, that second sentence that you see on the slide, it did say, if you travel to the following states, you need to quarantine. And so if you check the website now, it doesn't say need anymore, it says recommended. So, these things are ever changing. I think they kind of realize that it's going to be a little bit more difficult to put that actual order and make that a part of their, decision to say, you can't do this without quarantining, but obviously putting in that recommendation gives them a little bit more flexibility without kind of crossing that line. But you'll see from those states lists, the big ones that are kind of probably going to pop up for us that already have or will continue in the next month or so with all this is the vacation season. Florida, Georgia, North Carolina, South Carolina, just traveling down the East Coast and going to some of those beach areas. You'll get a lot of employees that just commonly vacation, whether it's Hilton Head, whether it's Outer Banks, or just Orlando or anywhere down there. Those are going to be the hot spots. If at that little bullet point at the end, questions about travel and quarantine, check out the PA Department of Health. There's great information there that kind of goes over the common questions that you guys probably are just having right now that are just popping up. Well, what does that really mean? If I'm traveling down to, say, Alabama, obviously if you're going to Alabama, it's recommended you quarantine. But what if it's like a in-between state somewhere in there that you're just passing through on the long way out to, say, Virginia or say West Virginia or Kentucky or something like that? I think the language in the questions say that, if you're just passing through, it doesn't count. It's you going through, being in that state, and then interacting with people. Whether or not that means, paying money to the gas station attendant, I guess that technically means you've interacted with somebody in the state and that would qualify. But if you're just zooming through, you have enough gas to make it through one of these hotspot states, I think in that case, that's a little bit different. But again, these are ever-changing, unknown areas that we get a little bit of information from the Department of Health, and then we have to, interpret that the best we can. Again, this isn't a requirement, but is a recommendation. As part of that, they don't dictate how. The Department of Health won't dictate how employees or employers are supposed to implement this policy to your employees and different things like that. But they also recommend, hey, make sure you follow the Families First Coronavirus Response Act. And I'll let Brian Joseph go into some of those details.
Thanks, Alex. So what is implicated by the quarantine recommendation and questions we've gotten from certain clients is, what happens if we make them quarantine as a policy, a safety policy? And in addition, as we're talking that the orders might change and instructions are changing day by day, what happens if they update it to say that quarantine is required? Do we have to pay employees, and what are we supposed to do with that? And so that ties into the Families First Coronavirus Response Act for paid leave. One of the conditions of providing paid leave to employees is if they're subject to a federal, state, or local quarantine order. In addition to that, if they're advised by a healthcare provider to self-quarantine, if they're experiencing symptoms and they're waiting for test results or something like that, if they're caring for an individual, maybe a child or a family member that is either is required to quarantine or is experiencing symptoms, if you're caring for a child whose school or childcare is closed because of COVID, all of these will entitle employees to varying levels of paid leave. Go to the next slide. So as a foundation, so covered employers are employers with fewer than 500 employees, with a small exception being if you have fewer than 50 employees, you may be able to get an exception from this if you show that this jeopardizes the viability of the business paying employees while they're not working. And then eligible employees are just all employees by employers that are covered, with the slight caveat that you have to work for 30 days for this employer for the instance of receiving the additional weeks under caring for a child whose school or childcare was closed. And so for calculating the amount of leave and the amount of time, thank you. So 2 weeks, 80 hours of leave at the regular rate of pay if they're unable to work because the employee is quarantined due to an order, or if they're experiencing COVID symptoms and seeking a medical diagnosis waiting for test results. And then they're entitled to 2 weeks of paid leave at 2/3 of their rate if they have a need to care for another individual who's subject to a quarantine or who is experiencing symptoms, or to care for a child whose school or child care provider is closed because of COVID. In addition, though, to caring for a child whose school or childcare is closed, they can be eligible for an additional 10 weeks, depending on the conditions of that situation, depending on the closure period, so on and so forth, at 2/3 rate of pay if their child's childcare or school is closed. And that could end up being important. We've already had a problem with school closures, but we don't know how this experiment with reopening schools is going to go. We hope that the processes we're implementing is going to be helpful in keeping schools open. We hope that this works, but there's still a relatively high risk that despite all the precautions that are being put in place, that ultimately the spread will increase through schools and schools may end up being closed, or whether they go to virtual learning, so on and so forth. And so this may end up being a problem again. Next slide, turning it back over to Alex.
Yeah, so one of the ultimate questions that comes out of that is with having to provide that leave or 2/3 pay and everything, can you actually restrict your employees' personal travel based on the different recommendations of quarantine? It's a difficult question that's still kind of unclear right now. You know, one of the first employment law things we'll be looking at, is it just an at-will employee, or is it a contract employee that has a little bit more protections than rights? Certain states, I believe it's Colorado and New York, actually have laws that prohibit employers from discriminating against an employee based on their lawful out-of-work activities. And something like that could apply to employers trying to say, we're not allowing you to go vacation down in the Outer Banks. However, we're in, you know, as the common word is, unprecedented times here of also trying to factor in the best way to maintain a safe and healthy workplace for your employees. And whether it's actually restricting their personal travel, that's again, kind of an unclear area, but there's other things you can do, such as taking the policies you already have and continuing to implement them in better ways based on the information that continues to be presented by our Department of Health. Uniform requests to make the employer aware of travel plans. So you know, all right, I have this employee going down to this area. And if you're following the recommendations, you know, maybe it's anyone that does that is working, teleworking when they come home for those couple of weeks, if you're capable of doing that. But the trick is with all of this stuff, whether it's the monitoring, reporting, or asking who's traveled where, is making sure you're doing it for everybody uniformly. You can't kind of isolate an age group. You can't isolate, you know, certain only this part of the staff, but not all of that part of the staff, because then again, you're going to be facing these discrimination issues. And you want to make sure any policy you're adapting to this is uniform. If you go to the next slide. So yeah, just making sure, same thing with the points there, making sure it's all applied uniformly. An employer may ask for a doctor's note, again, if it's consistent with their employment policy as well, and making sure if somebody feels at risk and they have those symptoms, and getting some kind of certification from doctors, because you have to think of if this ever gets questioned, what did you do as an employer? Did you follow the recommendations, or did you kind of just shrug your shoulders and go, Joe just, you know, he always goes down to Florida and we figured it would be fine. Making sure you're kind of taking those extra steps to follow these ever-changing rules, because most likely next week, as the Department of Health has said, the state list will be updated, and there'll be new states on there that we didn't predict would be on, or maybe some of those states are taken off. So just remember those things. And the last kind of point there was just requiring an employee to be tested may violate certain acts as well. So you have to be careful of the policies you put in place to require testing if they're not able to, or I know there's been certain rules in regards to requiring antibody testing, if that's even permitted as well. So again, a lot of this stuff we can't give clear answers on, but we can provide certain direction. So with that, I'll pass it on to the next topic.
Okay, now I'm unmuted. Thank you, Alex. Topic is resistance to the new normal and business owner rights and obligations. And I'll say as a preliminarily, I cringe at the new normal phrase as a cliche. There's nothing normal about this, but no one wants to get sick or unknowingly make someone else ill. So we have to do things a different way. Even looking at the material that Alex and Brian Joseph just presented. Normally, we as employment lawyers are the last ones to encourage employers to discuss with an employee his or her personal life. We usually say if it's not relevant, keep the personal life out of the workplace and don't ask a lot of questions about it. But now it is relevant. That's changed in a very limited way. We have to do things a different way. Even this morning is different. I teach seminars on a regular basis. On March 6th and March 9th, I taught 2 seminars, one over at Albright for Center for Excellence in Local Government, the other for Sewage Enforcement Officers Association Convention in Harrisburg. Woke up, got dressed, drove to the site, had a nice buffet meal with friends, gave the seminar to a packed room, lots of handshaking, very little hand washing. Drove home and went back to work back home. And look at today, it's all on Zoom. There's no sharing a meal. We don't shake hands. These are now among office supplies that we give out. It's a very different way of doing things, and it's an adjustment. And you look at that, and there's some resistance going to be natural, and I want to talk about how to handle it. I mean, first, there are measures we need to take as employers for employee safety. Here's the front desk at Kozloff Stout. There's plexiglass shield, hand sanitizing statement, and a statement of our expectations. On the front door, we state that we require a mask to enter the building. The next slide. In addition to these measures, there are policies that should be put into effect. And protective measures are often simple and readily available. Start with policies. In our office, everybody goes by the reception desk, has their temperature taken with a contact-free thermometer, and it's logged. Each is asked about symptoms and exposures. Policies should be geared to avoid congregating, no coffee or snacks in the break room or gathering at the water cooler, bring your own. Safety doesn't have to be expensive. If you look at the items there, all of these items can be purchased at any supermarket or general merchandise store. They're items that we have in our home, but they make a big difference. Go to the next slide. These are some of the state safety requirements and suggestions, and they're available on websites to which we link, so I won't read them off. These are intended to limit exposure, keep workplaces and surfaces clean and sanitized, and to prevent potentially contagious illness from entering the workplace. And you can see some of them are very practical steps, and some of them are policy related steps meant to limit contacts, limit outsiders coming into the office, and to screen for potential problems. Go to the next slide. The business reopening requirements that were set out by the state. These requirements are for businesses that are open to the public or to clients for limited exposure. And that again means limiting numbers of alcohol holding, cleaning, requiring masks, installing barriers, setting aside special shopping hours for those at risk, such as seniors and those with health conditions. These requirements also suggest alternatives to in-person visits to the facility. Such as curbside pickup and online ordering, and limiting use of certain checkout lanes to maintain distancing. Go to the next slide. I believe that I'm friends with some of you who are on this conference on Facebook. I have a wide variety of friends. And I see regularly some of the social media rumors, innuendos, and reasons that people give for not wishing to wear a mask or observe some of the distancing requirements. And here are some of the common ones. And I'm not going to read them to you. I'm sure that many of you have seen or heard some of these. There was an article in the Reading Eagle about it several weeks ago. And these are deep-seated. Many hold sincere beliefs about rights and liberties and are not trusting, maybe for a reason or maybe for no reason, but they're not trusting of authority. But don't let these social media epidemiologists and constitutional scholars control the narrative. It's your business. You make the rules and you pay the penalty if you're caught breaking the law. Go to the next slide. So what do? How do we deal with this, what I call background noise? We need to stay compliant. We need to keep employees and customers healthy. You can't cut corners. You have to follow reasonable requirements, but there may be times when some give and take is needed. However, keep in mind, you can't run a successful business if your employees and customers get sick or end up on quarantine. And some of the give and take will be, for example, within the Americans with Disabilities Act, which we'll talk about in a few minutes, and the reasonable accommodation process and the interactive process where you actually talk to your employees. Others will be just a matter of different ways of doing things that may be equally safe. But I think that it's a continuing process, and I think you have to look at both continuing changes to the regulations as well as the needs of your employees and your customers to keep everyone safe. And with that, I'll turn it over to Dan to talk about ramifications of violating the law.
Okay, on to the next slide here, please. Next slide, Rachel. Well, okay, let me tell you a little bit about it. So can everybody hear me, right? And you don't hear the flock of angry crows that are outside my window right now, banging against my window, pecking at each other, I think, or the reflections in my glass. So, all right, so let me tell you a little bit about what's going on. Back on May 11th, the governor, you probably saw this or heard about it, the Governor Wolf became pretty angry when he heard that people weren't going to go through and take care of any enforcement. And frankly, I think that still lingers out there a little bit today. But if you recall, back during that presentation, there was a lot of pushback that was coming back from any enforcement from any local agencies. Even the local district attorneys have taken the position that they aren't going to step into this area and become mask police and so forth. And the governor came back at that point and said he's not going to put up with any politician anywhere in Pennsylvania that jeopardizes the lives of the citizens of these counties and their constituents of Pennsylvania. And he made it very clear that there were certain types of action that can be taken. And we talked a little bit about that earlier when we were talking about the restrictions that have recently been reimposed back on the bars and the wineries and so forth. And I heard the conversation that, some people may be able to not follow the rules and regulations because they're not going to be inspected. And I think that's right, but you have to be very careful. We'll talk a little bit about that in a minute. But but it's interesting because I suspect it's PLCB or the enforcement agency that's coming out and looking at the wineries and the bars on a regular basis. And if they see that you aren't following it, you put in jeopardy risk of losing your liquor license. And that isn't just where it ends. So it also goes on to any other professional licensing as well. So for instance, for law offices, for accountants, for barbershops, the list goes on and on. Anybody who has a license that's issued by the Commonwealth, if they're not following the governor's orders or the recommendations, there's possibilities that they could lose professional licensing as well. The other piece of this that the governor made very clear was that they can also come in and revoke certain certificates of occupancy. And one area where people don't usually think about it immediately, but that is how it impacts your insurance. So your business, your liability insurance, your workers' compensation insurance, all those things may be impacted too, because if you're not following the law, most insurance policies will have some exception to that. So if somebody comes in and becomes ill and they believe it's because you failed to follow the proper procedures, you get named in a lawsuit. You go to your insurance company and say, cover me. They say, hey, wait, you weren't following the law. We have an exclusion in your coverage that says we're not going to provide you coverage. So you might find yourself at risk there. So the important takeaway with some of this is make sure that you're being compliant, make sure that you're watching what you're doing, and try to follow what's out there. Now, I will tell you, that's not easy. And I think as Brian alluded to at the very beginning, even here internally, we have a bunch of attorneys at work here that look at laws, interpret them every day. And we were reading through the governor's latest order and trying to interpret what exactly that meant. You know, it was one of those things where as you read through it, you can have all, and frankly, there was 4 lawyers in the room, and come to no surprise, there was 4 similar but slightly different interpretations of what it means. And in the new order, there's enforcement remedies there where the governor specifically calls out and makes it very clear that the agencies that are responsible for licensing can come out and cite you and take action against your license if you're not complying with the law. He also is called out in this most recent order, local authorities to do the same thing. It's still unclear what will happen, but I think you need to be very careful about what you do for all those reasons we just talked about. So without further, at this point, that's really my area on the enforcement. I'll pass that along to the next speaker.
Okay, thank you, Dan. I'm going to talk about the ADA and HIPAA. You will, as a public accommodation and as an employer, potentially have to make accommodations for an employee or customer with a disability, or have to keep confidential health information on an employee under HIPAA. Under the ADA, businesses open to the public must provide individuals with disabilities equal access to the business's goods and services. One of the reasons customers may give for not wearing a mask is having a breathing problem such as asthma or COPD. The ADA requires reasonable modifications for practices and procedures to ensure that there's equal access. But that doesn't necessarily mean allowing the shopper to come into the business without a mask on during regular shopping hours. It could mean asking that individual to use an online or phone ordering service with curbside pickup. There may be specified shopping hours for at-risk populations that they would be able to avail themselves of, or possibly using a face shield that allows more air circulation as opposed to a mask. There are other possible accommodations that are reasonable and achieve the end of protecting the public with making some modifications. I'd like to talk to you further about the ADA. It applies only to disabilities. It does not apply to social or philosophical objections that you believe that the mask is a symbol or a muzzle. That doesn't matter. It's something along the lines, as I said, of a respiratory issue that would prevent the wearing of a mask. There is the right, just as in employment, there is a right to refuse an accommodation where the individual poses a direct threat to the health or safety of others. You don't have to give the exact accommodation that the customer or the employee wants. It only has to be reasonable, not an undue hardship, or pose a direct threat to others. At the entrance to your building, there should be on notice. The public should be on notice. The right to refuse entry or refuse service to an individual not wearing a mask or face covering, but it also should contain a statement on medical exceptions or accommodation requests. I was at the supermarket a few days ago. It says mask required for entry except medical accept medical conditions. But it can be placed the same way as your no shirt, no shoes, no service sign. And generally it would be treated the same way. An individual is not required to carry a medical note or other documentation of a disability. You're not required to say, well, where's your doctor's note that you have asthma? Where is your medical card saying that you don't have to wear a mask? And as I'll show you later, if they produce one, look at it rather carefully. There are some fraudulent ones out there, just like fraudulent service dog certifications. Go to the next slide. You're at the next slide. HIPAA is sometimes invoked by individuals not wishing to wear a mask and citing their right not to disclose their medical condition. But that applies to healthcare facilities and to employers. It doesn't apply to a store's or restaurant's relationship with its customers. It applies to confidentiality, disclosure, and use of protected health information by healthcare facilities and services such as doctors, hospitals, clinics, and insurance companies, and also employers who have confidential protected health information that has to be stored outside of the employee's personnel file in a locked cabinet with only need-to-know access. Go to the next slide. As employers, there are certain inquiries that you can make under the ADA and certain actions you can take under the ADA and certain ones that you can't. And there's been guidance given by the EEOC on these issues as to what you can and can't do. The screening for body temperature, even though it's considered a medical examination, even where there's no contact, is considered a medical examination, but an employer may because of the need to do so. An employer may ask about symptoms, the routine questions that you get. Have you had certain fevers, respiratory symptoms, digestive symptoms in the past 24 hours? And have you potentially been exposed to COVID-19? Can also ask an employee to be tested. For example, if the employee is self-reports showing symptoms or is clearly showing symptoms, the employee can be asked to be tested for active infection. Employer may not, however, automatically exclude an employee that is in an at-risk group or perceived as being in an at-risk group unless that person presents a direct threat to the safety of others, not to themselves. The EEOC will not allow you to decide as an employer when a person is a threat to himself or herself, but you are allowed to exclude the employee from the workplace based upon a direct threat to the health or safety of others. Although you can require a COVID test, you can't require an antibody test as a prerequisite to going back to the workplace. Because the rationale for that being that the COVID-19 test for active infection is a test as to whether a person has a contagious disease. The antibody test is simply whether they've had it in the past, and if they've had it in the past, the science says that they are no longer contagious. So it's not a legitimate inquiry. Just like you can't exclude an employee from the workplace because they're in an at-risk group or associated with someone in an at-risk group, you also can't postpone a start date or withdraw a job offer because of that status. Go to the next. Okay, I referred earlier to the give and take, and that give and take is the interactive process required for accommodation of employee disabilities under the ADA. And that is an informal process. It's with an employee in a risk group or claiming a disability, and it's a conversation, although you should document it, but it is a conversation to determine what is a reasonable accommodation, which allows the essential functions of the job to be performed. And again, it's a matter of reasonableness. It doesn't have to be prohibitively high cost because we are all cost conscious now. And it doesn't have to be an undue hardship. The essential functions that our jobs still have to be carried out. some of these accommodations, again, are very readily, are things that are readily available. Providing, for example, a better quality of face mask, like the N95 type face mask for an employee who might be at higher risk. Reassignment to a vacant position, although that doesn't mean you have to move someone out of a position that they're occupied. Work from home, if that's a possibility. Sounds like that's going to have to happen more. Moving their workstation if a person believes that they are at risk either to themselves or others. Moving their workstation to an empty office temporarily or further away from others, or putting up some sort of barrier. That can be a way. If the employee has paid leave available, vacation or sick time that's available beyond what's mandated, have them take that now. Reassignment of job functions that are not essential functions of the job, so that that person can maintain distance from others and doesn't have to go into higher risk situations. It involves, again, it's a matter of give and take, and what is reasonable, and it's a process of discussion, interaction between the employer and the employee. Let's go to the next slide. I call it swords and shields because it's using these, you can use these laws, people can use these laws as a sword to get what they want, or and you can use it as a shield to protect yourself. A couple of remarks on mask hesitancy. May have seen this card. There is no freedom to breathe agency. The Justice Department has made it clear that this face mask exempt card is in fact a fraud. Do not be fooled. Go on to the next slide. And sometimes humor is the most effective, because really it's better to laugh than to cry. And here's something seen outside of Why I'm Missing Restaurant and Bakery, used with permission of the owner. And I think it sets the right tone. I'll turn it over to Dan on that note. And what you're seeing on the next slide are the links that I was referring to earlier. So go to the next slide for Dan's part on Stop the Spread.
Yeah, so one more slide then, Rachel. Okay, so what you see there in front of you, this is a little poster that the County of Berks has sponsored, and they were available. You could go down, either on their website, you can actually get them and print them, or they actually had hard copies that were bigger. As you drive around Berks County, you'll see them at a lot of different business establishments. You'll see them actually even on the buses. The Stop the Spread, the do your part, stop the spread is kind of been their theme. And the idea is good. This is simply telling you and reminding your employees what they need to be doing. Stop the spread by making sure that you're maintaining aggressive cleaning protocols and so forth. Practice social distancing, the same things we've heard repeatedly over and over again. Wear your mask. Cover your mouth when you cough. Avoid touching your face. Wash your hands for at least 20 seconds. Sing happy birthday twice. I think that's what it works out to. And disinfect, not just at work, but at home as well, particularly if somebody's been ill. So we've come a long way since this all started, but every day it's a new challenge and a new change. So it's important just to try to keep up with where things are going, and staying in touch with us and others who are out there every day looking at these things. We have people here in our office, Courtney, Brian J., Alex, and so forth, that are constantly updating our presentation, making sure that our firm is doing what we need to be doing and trying to stay on top of things. If you have questions about that, please feel free to call us at any time. And I believe, Joan, is this at the end of our presentation, or do we have questions? That's what I thought. So at this point in time, if any of you have any questions, now is the opportunity to shout them out and let us know what you think. Well, it looks like we must have done a pretty good job of getting the information out.
I would jump in with one thing. Talking about the masks, I've served with the Cystic Fibrosis Foundation, even president of the board I've been doing it for 30 years. And cystic fibrosis is, of course, a lung disorder and a very serious thing for kids and young adults. Their life expectancy is now up to 39 years. But those people who do have serious lung disorders, they're going to be the first ones to put a mask on. So as soon as you're getting resistance that you have a medical condition with your lungs and you don't want to wear a mask, chances are really high that's really not the case. Those people are wearing masks, and they would wear masks typically when they were discharged from the hospital for their IV antibiotic treatments and things like that to tamp down the infections in their lungs and so forth. So I kind of find it, difficult sometimes to stomach when I hear those kind of things going on, because those of us that have been in that service for a long time know that that's really not the case when you have those kind of conditions. That's just an aside.
So Rachel, can I ask a question?
Yes, please.
Okay, so we have a staff member who is, going to South Carolina next week.
One of those endless scenarios.
Here we go, right?
Yep.
First thing, and I'm like, hold it. Just it's going to see family. And I'm like, this was a planned vacation, first of all. It was a planned vacation. 3 weeks, right? Come on. So 3 weeks, and I'm like, hold it. So that's for us, for a staff, we're small staff. 3 weeks of supporting somebody is a lot of time, for us as a small business and a family business, by the way. So now it's like, you're going where? Like, that's the first thing. So remind me again where you're going. And then he's like, well, now we're supposed to quarantine, right? So we're supposed to quarantine. And I'm like, now I got 2 more weeks. Like, you're supposed to come 2 more weeks. And then he's like, okay, so as an affected person, it's like, do I have to make him quarantine? I guess that's the biggest question. Is it the employer, am I mandated to make him quarantine?
Well, the act, what currently is, it's a recommendation that they quarantine for 14 days when they return. The interesting thing right now is that the way it reads is that if you are subject to an order that is subject to an order to quarantine, then the CARES Act would come into play, and you'd have the employee would be entitled to 80 hours worth of paid sick time. Right now, I don't think it's an order, it's a recommendation.
Okay.
And so, but then your scenario is if you order him to quarantine, he's probably going to have some fight to say, well, it's not a state order, it's not a local order, but my employer is ordering me, therefore I may be eligible for those 80 hours. So I guess the question is, could this employee, if he's going to be eligible for those 80 hours, is there anything he could do remotely that you could get out of him some work? Because if he ends up qualifying for those 80 hours, he gets to sit home and do nothing for 80 hours. If you're able to get him to work remotely, even if it's inefficient or it's not highly productive, at least you're getting some work out of him in those 80 hours that you might be required to pay.
Like, can he research can he do research into some of the vendors that we talked about with like exploring new opportunities, or looking into creative ways to deal with what could happen in the fall?
Right.
So, and develop some recommendations in those 2 weeks if he is going to be home. And that way you're getting something out of him from a safe space, and then you're not necessarily having somebody else doing it and not having them doing stuff physically, taking away from somebody who is there present, physically able to do work, potentially. It just being creative,
Right.
Plan it how you plan it. Is some of the things that we've talked about is maybe just thinking, don't see it as take it as an advantage. take it to your advantage. Don't look at it as a negative.
Is there any?
Well, I know, but that is like 2 more weeks with it.
I know.
So there's
Sorry,
two,
Joe, go ahead.
let me just interject for a second. There's a couple things that are happening, and this is right now the area that I'm getting the most questions about. In fact, sitting in front of me, I have a policy right now for one of my clients that's dealing with this exact issue, and we're looking at what others are doing about it. There is no easy answer, and let me just flip it a little bit too, because no matter, suppose you have this person come back in because it's a recommendation, you bring them back in. You might have another employee who sits next to him say, well, I feel now that I'm being jeopardized and my family's at risk as well. So you have to take all this into consideration as you're kind of thinking about the next step. I think at the end of the day, right now, it's a recommendation. So if you are, and since, again, this is the Family Business Alliance, and they typically are smaller businesses, you need to think about, how is that going to impact your business, your viability into the future. So I think what you need to do is, while it's nice to be able to say that we sit here and say, yeah, you should quarantine them for the additional 14 days, that may not be realistic, particularly since it's a recommendation. But then the real question comes back to, what do you do to protect your company? What do you do to protect your employees? And I think at that point, you need to start thinking about making sure that you have certain protocols in place, like when they come back, they need to take certain steps, whether that's doing exactly what you're doing now, temperatures and so forth, or can you move them to another part of the building? Can you keep other people away from them? I'll give you an example. I have one client who just had a similar situation for somebody who was down in Florida, went down to Disney. They came back, but with his job, they were able to isolate him from the others fairly reasonably. Everybody understood, he understood that too, and they've kind of kept him separated so that they can continue to monitor him, and made certain reporting requirements for him, kind of those things that Joan was going over a moment ago. So there are other options. You need to think through them carefully, because each string you pull, it has another impact. And it goes back to what the two Brians were talking about. The scenarios are endless. So you just got to think, what's in the best interest of your business? How are you protecting your business moving forward so that you remain viable? And we're here. I mean, we're here to help you with that too, to kick ideas off and kind of help put things together to protect you as well.
I mean, I'm not saying that it's right to give ultimatums, and you shouldn't, because you have to deal with your employees at the end of the day. But in your discussions, have you talked about the prospect of maybe postponing the vacation until a safer time? Is that a possibility, or is there some compelling reason, or a prepaid trip?
And I'm sure that's a hard conversation to have with
He
someone.
actually told me that. He said, well, we might be, because they're not sure what's going to be open. It is. It's like, am I allowed to ask him that kind of stuff? That's another thing. It's like, am I allowed to ask you, where are you going? What are you doing? That's kind of personal, So, and they're not sure what's going on. So they're not sure if, what's going to be open. So there might be postponing, but right now it's supposed to be next week. So I'm like, again, now am I getting, it was like, we have covered staff. Are you staying? You're not staying. It's just another logistical nightmare.
I mean, again, you have to think about good employee relations, and you can't get into inquiries that might get into other protected class statuses as to who he's going to see, and where in particular in the state he's going, where he might be visiting. You don't want to risk getting to avoid one issue, getting into others about his personal life. The inquiries need to be very limited. But it's a conversation. It's a process. It's a conversation, and it may lead to other conversations. But maybe there's some incentive you could give him to postpone the vacation worth his while.
And we do, Deb did raise her hand. So do you have a question, Deb?
I do. Can you hear me?
Yes.
Okay, so
Can hear her.
we actually have an employee in Florida right now, and we do not have a plan in place based on this, and she's been a long-time employee. So I heard kind of through the grapevine that they were going to tell her that she would have to quarantine for 14 days and she'd have to use vacation time. And I don't know that you can say that. Can anybody answer that question? And if they don't have vacation, then they have to take it without pay. But I don't know.
I agree with you, Deb. Yeah, I don't think you can require them to take vacation or take time without pay. That's what the CARES Act 80 hours would be about.
Okay.
So I think that they would be entitled to it. Then it becomes an issue. So I think the issue becomes, the first analysis is if the person can come back into your workplace and not be a danger or a risk to others in your workplace. Then if they can, we have one large employer who consulted with their doctor and came up with a list of protocols that were going to be required from people to travel to these out-of-state locations. And they would isolate them, make them 20, absolute positively must wear their mask at all times, not allowed to congregate with other people, things like that. So they came up with protocols.
And she does have her own office with a door, so she really could stay in her office all day. And if she has to come out, she has to wear that. That's what I'm thinking, because you know what business we're in, and we are so busy right now. We can't afford to not have her here. And I don't know that what she does, she can do from home. I'm not positive. So, but I didn't think they could tell someone they had to use vacation time. So
now, does that person front the public? Do they then meet with the public? And
no. She's kind of like in the back, but she's an integral part of the office.
Okay.
I think, Debbie, in that instance, you could probably pretty easily set up some protocols to make sure that you're continuing to monitor and testing and keeping her away from others.
Okay.
Since it's a recommendation in particular, you can. Part of the other piece of this, and we touched on a little bit, but to keep in mind too, under the Emergency Family Medical Leave Act or the Emergency Sick Leave Act, if they were to go to a doctor and the doctor made them quarantine because they're in that area, that kicks those into place too. So it's a good idea to have all of that stuff in place so that there's not any ambiguity, so they know what they're going to be doing and how it's going to work for everybody. Right. So it's better to get out in front of that now.
And see, and that's what I already had mentioned, that we've got to put a plan in place. It's just that we are so busy right now. It is just, we don't know whether we're coming or going. That's how crazy it is. And maybe I can ask you this question. So when we were in red and yellow, all of our closings were done. We would just take the packages out to the car with our masks on, let the people sign the documents. We asked the lenders to make sure those people had a chance to review those documents ahead of time. Whether the lenders did that or not, we don't know. But then we would just go out, retrieve the documents, review them, and then tell the people they could go. Now, when we went green, we purchased canopies, so they're outside. Now we're meeting with our customers outside with masks on. So I'm not sure, can we still continue to do that? I mean, there's usually not more than 6 or 8 people at a table. Like I've been helping out reviewing the loan docs as a former lender. So I just take that person and we just sit at a table by ourselves so that I'm not around. I'm trying to stay away from a lot of people. So what do you think about that?
So Debbie, again, I think we're keeping in mind the social distancing requirements. I think it's, knowing your offices, there's some big conference room, they're not huge.
No.
So if you get more than 2 people or maybe 3 in a room, you're not going to be able to social distance.
No, and that's the thing, Dan. We haven't allowed people into our office space because on any given Friday, we could have 300 people coming in and out of our office.
Right.
So even that's just
sitting in your waiting room. I've been there during those days.
Yes.
So I think the idea of what you're doing outside is a great way to do it.
Okay.
As you have more air moving, and you can kind of still do it under the tarps or canopies or whatever you.
Yeah, they're just because they don't have drops. It's just like a rooftop. So.
And Deb, one other thought is You know, I asked the question and then I'll have an answer here, but I mean, why is it your responsibility to review the loan docs with them? Why can't you require the bank lender to review the loan docs with you and send you an email that says, hey, I reviewed all the loan docs with Mr. and Mrs. Smith. They know what they say, so that your responsibility is just to get them signed at the settlement table and not waste 35, 40 minutes running through all the documents with them.
So Brian, I have a response to that. After TRID came into place back in 2015, it was almost like the onus was put on the settlement officers to review those docs. There's even a compliance form from the lenders in the packets that state that the title company will be reviewing the documents with you. So most lenders don't even come to closing anymore. But so yeah, it's just crazy. And myself as a former lender, I always reviewed my docs. I thought it was my responsibility to review my docs.
Right.
So it's crazy. We had one lender who called who said, oh, they absolutely have to sign today. You know how Fridays are. It's a refi. We said, well, we'll let you settle, but you have to review your customers' loan docs with them. We are booked.
Right.
So they are coming in. But you know, it's just it's difficult. This is really getting very difficult. So
well, right now we're still doing all of our executions and will executions and so forth outside as well, Deb.
Really? Okay.
Yep.
Oh, well, that's good to know, Dan.
Debbie, for what it's worth, Debbie, what we've been doing is scheduling an extra appointment with them. For example, the wills and powers of attorney. We schedule an extra phone appointment or Zoom appointment with them and go over each document so that when they come to sign, all that they're doing is signing. There's no explanation at signing. It's just, we reviewed these with you, now just,
we need signatures now. Yeah. And that's what we were hoping that the lenders during this time would be helpful. So I don't know. A lot of times it seems like the borrowers haven't seen the docs, but I'm sure the lenders are just as great, because I got to wear both hats because I was a former loan originator. I'm sure they're all crazy busy too. So just trying to get people to closing. So it's just been crazy.
Well, thank you for sharing, Deb. Everyone has been going, it's tough.
Welcome.
So I don't know if ladies from Solo Labs, do you have any questions? Just wanted to offer that up to you. Okay. Because it's almost 9:30, so I just wanted to say thank you so much to Kozlov Stout, all of you. This is every single time you're on. It's very, very helpful. As you can see, and I know you get it all the time in questions from your clients or just those who probably just know you and need help. Everyone is just confused and tiptoeing, and there's a lot of, I'm glad that you had this slide about what people are saying on social media, how it's not real and we're sheeple, and like it's tearing friends and family apart right now, and it's hard. So thank you so much for touching on that. But to all of you, thank you so much. I know this has been helpful. This was also recorded, so we'll be sharing this. I think it's okay. I'll share the PowerPoint with you as well. That way you have the links and all of the contact information for those at Kozlov Stout. But on behalf of GRCA and the Family Business Alliance, thanks for joining.
Thanks, Rachel.
Yes. Thank you.
Thank you.
Thank you.